Okay, so welcome everyone to the Biointegrative Health Center webinar on diabetes and your immune system. Is anyone having problems or issues hearing me at all? No, I guess not. Just raise your hand or share in the chat. So a couple of housekeeping. If you during the presentation, if you can just put your questions in the chat, and then we will answer your questions as we do our question sections. We're going to have two question sessions, one in the middle where we'll take some of your questions from the chat and Dr. Nario is going to answer them live. And then we will have at the end of the webinar, we will have a Q&A session. So that where you can unmute yourself and you can ask the questions to him directly. During the end of the Q&A session at the end, during that we will post a poll, so if you could participate in the poll and give us some feedback, and the slideshow will be sent to you tomorrow just for your reference if you would like. And then I will unmute you as you're coming in. However, if you have background noise, if you want to just mute yourself, and then you can unmute yourself at the Q&A session at the end of the webinar. Okay, so again, please put your question and answer in the chat, or if you want, you can also use the Q&A section. All right, so today's presenter is Dr. Nario from Biointegrative Health Center. So I'm sure a lot of people are very know him and he will do a in-depth discussion about how diabetes affects your immune system. Okay, so I'm handing it over to him. Sorry, that's me messing with the.
So good evening, everybody. Thank you for inviting me for this webinar. And for all the people who organized this, thank you so much. You recognize the hard work that you guys put into this. So let's start with, okay, next slide. Next slide. Hello, can you hear me?
Yeah.
All right.
Sorry. Okay.
All right. I already diagnosed myself on the internet. I'm only here for a second opinion. So this is what we always see most of the time in the clinic. This is technology, maybe against us or with us. And the majority of our patients are so knowledgeable that they check their own symptoms. And this is the common scenario that we fight. Not only about diabetes, but almost every disease out there. That's why every doctor, lesson for you, you need to know your science, because every patient that goes through that door knows something about what's going on with them. Next. And this is from your favorite doctor, Mr. Wikipedia. According to him, diabetes is a metabolic disease in which there is high blood sugar levels over a prolonged period of time. As you can see, this is a very vague definition of what this disease is. That's why you probably would want to hear your doctor put their 2 cents on this to define it a little better and be more specific. But because we don't bite, we don't charge for just asking questions. So just come to us and we will answer these questions directly for you in a more accurate way. Next. So let me define to you what diabetes is. So type 1 diabetes is insulin-dependent diabetes. This is initially where our pancreas fail and would not produce any more insulin. Type 2 is adult onset, and this is what we call late onset diabetes, and it presents insulin resistance, wherein the cells fail to respond to insulin already, and meaning it's eventually going to be lacking in production because it's just going to be tiring itself out. And this is where usually rooted from sugar overload from the food, from being overweight, lack of exercise, and number three would be less of a reason for you to have diabetes. This is gestational, and this is when women gets pregnant, and they usually don't have history of diabetes and just develops this after pregnancy, or I'm sorry, during pregnancy. Next. So this is your pancreas actually texting you that he's done and he doesn't want to do work anymore. This is type 1 diabetes. It's autoimmune based and usually it appears in childhood and it's not going to produce any more insulin. Next. This is your type 2 diabetes pancreas. I'm not ill. My pancreas is just lazy. So he just wants to sit on the couch and just do nothing. But he does something, but not enough. So initially it overworks. The pancreas would create insulin for you. Then it gets exhausted and not enough to be to the body to benefit from. Next. So this is how we diagnose diabetes in the past. We're not using jam or honey there in that picture, but you would see that is actually your pee. People pee in cups or in mugs, and they put their urine on the ground until ants surround it. And the reason for that is that pee that you see there has actually 180 milligrams of glucose or sugar in it. In order for somebody to get diagnosed before to have diabetes or not. That's why this is something that we do not advocate anymore. Please do not pee in cups and put it in the ground. People might trip on it. So come to us, and it's a pretty easy test to do. And you just go to the lab, and they'll definitely have numbers for you very quickly. Next.
Okay.
According to the American Diabetes Association, this is how we define diabetes now. Hemoglobin A1C is what we use, and these are the numbers. So that's why 6.5 is the one that you wanna be cautious about. If you're higher than that, unfortunately, there's diabetes. And below that, that's what we call pre-diabetes. And you're almost there, but not there yet. And this number, the hemoglobin A1C, actually shows you the sugar level that you had for almost 2 to 3 months. So it's not affected. People always ask me, "Hey, I ate yesterday. My A1C is high. It's probably not accurate." Yeah, nope. That's actually you 2 to 3 months already of intake of glucose and sugar, and it's pretty accurate. Next.
This is not working. All right, there.
So fasting plasma glucose. This is what we always see in our blood tests when we go on fasting, and people prick themselves on the finger, and this is the number that they always see. And the one that you really want to avoid here is seeing a number more than 126. And at least we suggest for you to be 8 hours fasting for this test. And again, as I said, leave the ants alone. And they really don't know and don't have the accuracy to diagnose diabetes anymore. We have better technology for that. Next. When you see this in your glucometer, you are really in trouble. You want to see a number, and a glucometer should not say diabetes to you. Next. So we hear so many different causes. And again, genetics gets the blame. And this is the statement that we usually hear. It's not that diabetes or heart disease or obesity runs in your family, is that no one runs in the family nowadays. If you can remember in the good old days, our parents, grandparents, Adam and Eve, they never had problems with diabetes. And this shows you that genetics really maybe plays a small role here. Even now, when you look into medical books, they would tell you the unknown causes of diabetes. But now there's so much research and evidence that it points to our activities and diet that we have nowadays. And just going back to the diagnostic tools, another one is what we call oral glucose tolerance test. That's another accurate way to do it, where we feed patients a bunch of sugar load, and then we check their levels if they can tolerate it. But that's really one of the rare ones, rare testings that we do, because it's just time consuming, and the effort of that one is pretty aggressive. Next. So when your doctor says, hey, red circles are your red cells, white circles are your white cells, and brown circles are donuts, we need to talk. This is when you know, again, this is a red flag. And these are the causes of the dreaded disease called diabetes nowadays. And I always want to tell patients that it's not only glucose or sugar that causes diabetes, but also fatty acids. Because these fatty acids or fats converts into excessive carbohydrates and sugar that also contributes to the sugar load that diabetes can actually inflict into our system. Next. And you would see here, this is why I was telling you that insulin resistance occurs with diabetes. That is the receptor that you need to stimulate in order for your sugar to be used up by the cell. But something is blocking it. And that is what we call the unknown etiology in medical books. But again, as I told you, that could be the junk food that we ate. That could be the fat that we ate from fast food. Again, they think it's undefined, but now they know what this plug is all about and how we remove it to prevent diabetes. Next. Insulin resistance is actually what we call not effective use of insulin. And when insulin is as a big player, it facilitates the entry of sugar into the cells in order to be used up. But if you again don't have that function, as diabetes 2 plays a role on this, you now develop actual adult onset diabetes. Next. Three symptoms that you need to keep an eye on. If you have this, maybe you do have diabetes. Polyuria, you're urinating a lot. Polyphagia, if you're hungry, always looking for food. And polydipsia, this is when you drink, 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 and you're always thirsty. And these are what we call the three P's of diabetes. If you have them, you need to get checked and be assessed. Next. Now we link diabetes to immune system. So immune system is actually the complex network of cells and proteins. So it's like I want you to imagine it's your fence that separates your home from invaders or burglars. And it helps the body fight infections, meaning that it actually has soldiers or components that it creates to fight infections for us. And this is the army, as we call it. And as you can see, these are the white blood cells, the antibodies, the lymphatic drainage, the spleen, the thymus, the bone marrow. I want you to think of these guys as the members of the family that are living in that house. If somebody gets in there and tries to burglarize your place, oh, little Johnny's going to be coming out, grandpa with his cane. You got your shotgun out and ready to blast that guy into smithereens. So that's how efficient the immune system is when it's functioning properly. Next. So now let's talk about these specific invaders that we don't want in our house. This is your bacteria and the viruses around you. How to differentiate these guys is bacteria, they usually have a mode of entry such as cuts, you ate bad food or spoiled food, contaminated water, or even touching contaminated surfaces that got in contact with you and got into your system. A viral infection, usually we get it from person to person. Sneezing, coughing, we always know about COVID-19 being on how it's getting transmitted, uh, body secretions, and the virus always has this ability to invade inside the cells. And again, the duration is something that you can use also to determine if it's a viral infection or if it's a bacteria. So most of the time, viral infection only lasts for 7 days because the immune system gets rid of it. If it's more than 7 days, that's when your doctor tells you, all right, we need to get an antibiotic on board so that this bacterial infection wouldn't go crazy. Next. So this is the body's immune response, meaning when bacteria gets into our system, we actually stimulate an inflammatory response wherein increased blood flow would be facilitated to that area where the infection is so that all these the cells that I just mentioned would be ready to kill and access that specific bacteria. And of course, antibodies starts to get formed, the white cells go there, and with a common path of destroying the insult. And again, as I mentioned, bacteria invades the body usually from outside the cell, releasing toxins, releasing all these enzymes that's harmful for the cell. Going to the virus is pretty, I guess, resourceful. It goes inside the cell and integrates itself through our DNA, and it uses up the resources that we have inside that cell. It's like a parasite, and that's why it's hiding, that it's hard for the immune system to see it, and at the same time it's utilizing the energy of your own cell for it to replicate and also be more pathogenic in order for it to be a pest and destroy more things inside the system. Next. And this is where now I bridge the two conditions. When we all know this topic is all about diabetes and immune system, this is where it comes into play. As you can see, excess glucose or higher sugar loads burden the immune system. There's more of a scientific explanation to this, but I'm just putting it in simple terms. And you would always hear from diabetics, I'm sure you have a friend or a family member who's diabetic or has sugar issues, that whenever they have a wound, it's harder for them to heal, especially when you have infections on that specific wound. The reason for that is higher blood sugars impairs these growth factors to go to that specific area to build tissue, to build blood vessels again. And that's why high blood sugar is something you don't want when you're trying to fight an infection. And later on, I'll give you specific examples of how a diabetic is having a hard time repairing itself or killing an infection because of their actual condition. Another reason would be it's a food for infection to grow. As we all know, bacteria, oh, they love sugar. That's where they thrive on. It's like a big party for them. So when sugar is in your blood system, highly likely infection is just hanging around somewhere ready to blow up out of proportion. And another reason would be the loss of focus of the immune system. So the immune system, as I mentioned before, our body uses up energy. For example, if we have a disease process, it's going to focus itself on one thing alone. So if you have diabetes, the body's so busy controlling that blood sugar level, and then an infection comes into play. Now you have to activate your immune system. So the diabetes is part of the endocrine system. Now the immune system needs to work as well to kill that infection. But you have to remember the body needs to focus on one thing alone so that it can do its job. But now you're putting another task on that body and that system, and there's an infection that needs attention. So now you're going to divert the energies or resources of your body into two specific problems, meaning there's going to be, of course, less quality of work and more, I guess, distraction for the resources of your system. Thus, it's harder to kill infections when you have diabetes. Next. So this is the part where I show you how actually it can get out of hand for a diabetic in relation to having high blood sugars. This is where what I was telling you, that fat, don't misjudge fat, that thinking that it's not going to add to your diabetic problems, because fat, as you can see, can turn into glycogen, which is a stored version of sugar. Next. So as a diabetic, you would always hear this. It's the dreaded diabetic foot. People would complain about a stocking and glove distribution of numbness and tingling. And when a diabetic does not feel what's under their feet, and they're walking and they're barefoot, they wouldn't even know that there's a wound down there unless they check. And majority of the time, they can't. They don't even, because they don't know what's going on down there. And they thought it's just like ants walking on their feet and tingling. And it's something that's very overlooked with a diabetic case. And this is what happens. You build wounds, you develop wounds there that are undetected. And again, what's going to be next? It's going to be infection, because you don't wash it, you don't treat it, you don't put anything on it. Next slide. And this is what's going to happen. So you would probably hear this or hear this term gangrene when people with diabetes develops this type of complication. This is in result or in relation to number one, the circulation of diabetics are not good for the reason that glucose and cholesterol, as you can see there, prevents the travel of that blood vessel to send repair cells to that specific toe or foot to prevent that from happening. And number two, for sure, there's probably an ongoing infection there as well. That's why most of the time when you have this, usually antibiotic treatment is something that you would see that goes along with this type of condition. And that's why we promote, you always hear this, that we recommend foot checks and proper shoe care for patients who has diabetes, especially for the longer period of time. And the statistics says here 60% of non-traumatic lower limb amputations comes from diabetic foot. And again, now this is just one picture of the body where an infection comes into play and how it can harm a diabetic. The worst case scenario here is if this infection on that foot has not been controlled properly, now the infection will spread all throughout the body, leading to what we call sepsis or massive infection, now affecting different organs, lungs, heart, liver. And then, yeah, probably you'll end up in the ICU with that, but with massive antibiotics just to kill that infection because of again, the groundwork or the foundation of just being diabetic and having a lower immune system. Next. And this is what we usually see. This is, we're not going to be seeing a patient walking on their forehead with a post-it or a label saying diabetes. But this is the common presentation of diabetes now in the syndrome. We call it metabolic syndrome. And this combination is called syndrome X, wherein you would see central obesity, higher blood pressures, high triglycerides on blood testing, and also low HDL or good cholesterol on blood testing, and insulin resistance, which is the groundwork for diabetes. And again, yeah, the emphasis here mostly when they say, according to the Mayo Clinic, they're more emphasizing heart disease, heart strokes, and the predisposition of diabetes. But the word immune system is not really showing up, which I think we should put again emphasis on, especially during these COVID times that we're under. And you would see majority of the risk factors that are focused on the 60 and above has these comorbidities. That's why they now need to probably, or even the patients should be proactive about building that immune system in order for them not to get infection, COVID included. Next. So this is how powerful sugar is. Even the superhero succumbs to the temptation of eating sugar. Even Spider-Man could not reach for that cupcake anymore. And it's not an egg. It's not a yeah, but it's actually Spider-Man turned into an egg and bending that pole because of the overweight condition that he developed from eating sugar. Next. And this is the statistics right now. This is actually 2010. Imagine where we are now, 2020. It was estimated 285 million people has diabetes. This is a majority of them are 90% type 2, which again, I'll remind you, these are type 2 is adult onset and it's developed because of food, exercise, and lifestyle. Next. Here are more statistics for you. This is how much we're spending for diabetes. And unfortunately, 3 out of 4 people will probably have diabetes, and low income and middle income countries are the more I guess population that are affected by this. Next. And this is the prediction and how they foresee where diabetes would go. 1 in 11, 1 in 10, and unfortunately, 1 in 2. Hopefully that not this does not become a reality. Next. So all these numbers making me crazy. I don't like numbers. That's why I went to medicine. The thing here is I'm not there. I'm not presenting this to scare everybody. It's really more, I want you to take this with a grain of salt. We are not doomed in relation to getting diabetes and lowering our immune system at the same time. It's really all about the things that we do, especially food. We have to be aware, of course, cheap quality food, poor quality is something that will also bring us closer to diabetes. People not exercising, not doing activities. I know it's COVID, it's hard to exercise right now, but there's so many ways that we can change that lifestyle. Walk outside, do things inside your house, and also government policies in order for us to be protected. Our government should, or somebody who's in the higher seat or higher powers should promote policies that would prevent us from developing these types of diseases. And again, we should be aware of these warning signs as we move along and be proactive more about the signs and symptoms that we feel. Next.
Okay, so we're gonna take some questions from the chat. There's several of them. Thanks for participating. Hold on here. One of the questions was, can you clarify what you mean by insulin resistance?
Okay, so insulin resistance is, well, so when you have type 2 diabetes, meaning sugar cannot go in the cell. And as our pancreas, the one that creates insulin, it's like lock and key. I want you to imagine your key, your lock is the receptor. Your key to open that door is insulin. Once you that fits together, it opens that door. Now the door is open for for glucose or sugar to get into your cell to be used up by the cell as energy. So when there's insulin resistance, I want you to imagine that key is not fitting that lock. So the now when that lock is not opening up, glucose is hanging outside, making the pancreas think, huh, I have so much glucose there, I should probably send out more keys just to try to open that lock to make that glucose go inside the cell. But unfortunately, every key that the pancreas is throwing out there is not fitting that specific lock. And glucose is just hanging outside, explaining your high readings in your blood sugars in your blood. And that's why it's called insulin resistance, because that receptor is not opening up and it's being resistant to that insulin that's being made by your pancreas.
The second question is, what role does BMI play in diabetes?
Okay. Right, so that's a good question. BMI is actually the body mass index, as we call it. When you get over the BMI, it's actually a risk predictor of you having a higher risk of cardiovascular diseases. Being in the normal BMI is actually a good parameter, but I'm not saying always, because BMI is not accurate for people who has more muscle mass. So the bodybuilders cannot use BMI as their parameter because we're actually weighing their muscle. And for them, BMI is not a good accurate reading. So the normal BMI is usually 18.5 to 24.9. You being there actually gives you a better prognosis of being away, not only for diabetes, but cardiovascular diseases such as heart attacks and strokes. And that's probably a good way to gauge yourself if you're doing okay in general and not just only focusing on diabetes.
Okay. The third question, and
What are your thoughts?
Isaiah's gonna read it, so go ahead, buddy. Okay, never mind. What are your thoughts on intermittent fasting in relation to diabetes?
Yeah, okay, that's pretty good. That's a good question. So intermittent fasting is actually starving your body in order for you to use up the other energy sources that you have. The thing with intermittent fasting is when you cut yourself from sugar or from your regular diet, probably is high in carbohydrates. Now you will use up the fat cells that you have in store, and fat cells actually create more energy for you. That's why that method I highly advise to do with people who has I guess pre-diabetic states. I don't want them to use this when they're in the state of bad diabetes. For the reason that, for example, a patient who has diabetes who's taking insulin, because when you're putting yourself into a fasting mode like that, because when you go fasting for 12, 24 hours, even 48 hours, you are now going to drop your sugar. And with insulin, if you're using insulin, the purpose of insulin is to lower blood sugar. That's why you are in a state that you're going to put yourself in danger of putting yourself in hypoglycemia. And you don't want that because that's going to end up you being on a coma. Yeah, that's why I'm not saying for diabetics who are in bad shape, don't do intermittent fasting. You have to have a medical provider guide you through this. And intermittent fasting is definitely okay for any type of disease. Even if I see cancer patients, I definitely like that for that because it just ignites or self detonates all these cancer cells. But for diabetics, we just want you to be in a more controlled state, then we can talk about intermittent fasting. But definitely it's helpful, but it can be dangerous also if not used properly with medical guidance.
And then, uh, okay. So there's one last question I think we can answer at the end, but those are the questions so far in the chat, except for we can go on. Thanks everyone for the great questions. Very informative, very insightful.
Yeah, good questions. Good questions.
So we're going to move on to the next section of this presentation.
All right, so now let's talk about what can we do about this problem. And our approach is called, or my approach here also is called biointegrative medicine. The thing here is, yeah, I practice in a sense that I still apply conventional medicine. And to be honest with you, being on that side of the fence actually gave me a label. I call myself a mechanic. Why is that? Because I do symptomatic treatment only. And when I go for prescription medicine such as metformin, insulin, glucotrol, those are things that I see as just putting a band-aid. And yeah, if it's really going out of hand, we refer them to endocrinology. And again, what they do is add more insulin and they add more, yeah, metformin for these patients. Again, this is the old school of practice of medicine for me because I'm not really treating the problem. But again, worst comes to worst, if I need to, uh, next slide. So that was just a thing that I was explaining. And the thing here is, as I was doing this to patients, I was not getting the results that I want. But if we need to go this far, if a patient has really have high blood sugars that are uncontrolled, we will not be afraid to pull the trigger to ask for prescription medicines for help. But again, that's not going to be something that's going to be done long term on a patient. Next. So this is the side of medicine that we want to focus on a little bit more, the natural, the alternative type of medicine. And being a practitioner of such, I now label myself as a farmer. Why is that? Because I cultivate the rich soil of the human body. I'm not only thinking about the high blood sugars, I'm also thinking about the non-visible parts of the problem, such as the mental, emotional, spiritual. When you go home, are you always angry at your kids, putting your stress level up? So as we all know, as stress levels goes up, glucose or sugars goes up as well. And these are the things that's really easy to control without even adding medicines in there. And that's why I tell patients that medicine is not the only way to treat this specific issue. There are things that your doctor should ask you in order for you to minimize the external problems that can be controlled on your own and not through medicines. And this is what we call the holistic approach. And alternative remedies or treatments that I apply would be homeopathy, which I'll explain more about this later on. But this is energy medicine, even acupuncture to open up the detoxification pathways when we're having a hard time eliminating sugar. There are ways on how you apply acupuncture to help your body eliminate it faster. Detoxification agents such as chelation therapy, heavy metal therapy, that also aggravates the condition of diabetes. Oxidation, increasing oxygen delivery to the system through IVs, and also vitamin therapy. A majority of diabetics are also vitamin deficient and nutrient deficient. and also Chinese herbs and supplements. So these are all natural ways in order for us to achieve healing, not only for diabetes, but also an impaired immune system. Next. So just to give you a few foundational things that you can apply in your life, not only for diabetes, but in any type of condition. Lifestyle is number one. So lifestyle is very important. As you can see the word foundation there. Proper nutrition and water. So proper nutrition, when I talk about proper nutrition, I'm talking about try to, of course, if you're a diabetic, you try to avoid sugar, not only sugar, but carbs. And that's what I want to emphasize. Diabetics always has this misconception that it's only sugar that can make their diabetes worse. But that rice, that bowl of rice that you ate, that loaf of bread that you ate a while ago, that can contribute to the aggravation of diabetes. And for water, people think water is water. Not really. You have to have a good quality type of water. And this is when we emphasize about alkaline water. Alkaline water is, of course, the pH is higher than 7.5. And being in an alkaline state just gets you out of acidity. And acidity, as we all know, is bad news because who wants acid running through your system? Yeah, think about battery acid. How can the body work with that? And also with your water, add electrolytes to it. And unfortunately, the more expensive the water is, the better the quality the water would be. And that's just the reality of that. Exercise, as we all know, I see patients here in the clinic, it's COVID 19, can't exercise. No, you can't do that. There's always a way to exercise. Maybe indoors, maybe outdoors, is getting into winter, and other excuses coming up, but exercise has to be there. And then rest, always restful sleep is very important. At least 7 to 8 hours of deep sleep. It's not you 7 to 8 hours tossing and turning and bumping your husband or wife out of the bed. You have to have a restful sleep, and when you wake up, yes, I feel recharged. And meditation is an exercise not only focused on the physical, but also the mental, the spiritual. And this is where you align yourself and fix all these mental and emotional toxins out of your system that contributes to the disease process itself. Next. So the program that we apply for diabetics, and again, you would notice that why is he just focusing on diabetes here? The thing here is when you fix diabetes, you fix the immune system. So that's just the reality of that. And when we want to assess how severe diabetes is, this is the test. These are the tests that we look for: the A1C, fasting blood sugar, and again, as holistic practitioners, we're not only focusing on diabetes. As you can see here, thyroid is very important. If you don't have a good functioning thyroid, it's expected that you're not going to have a good regulation of your blood sugars. And the inflammation markers, the fibrinogen and CRP, we want to know how extensive that damage had been incurred by diabetes through these panels. And we focus lifestyle and education in our practice. And of course, nutritional supplementation is a more of a focus rather than actually giving patients prescription as one of our first line interventions. Next. So we put our patients in a specific anti-diabetic program here. And in this program, we do education and awareness. So we let them pass a food log for us, a weekly food log to see where we can intervene and help them eliminate specific food choices, and also cardiovascular exercises, medications. If they are using it, how can we combine it with supplementation and prescription in order for them to at least utilize prescription medicines at lower doses with the help of supplementation as part of their regimen. And lifestyle patterns, of course, the weight loss, diet, and exercise. And again, as I mentioned, supplementation. Next. This is the interventional part of what we do. We become more proactive about homeopathy, supplementation, and detoxification as well. And worst comes to worse, if we really can't control it, yes, as I mentioned to you, we will resort to the help of prescription medicines. But again, for a short period of time and then taper them off again using natural remedies. Next. Laughter is the best medicine. Well, unless you're a diabetic, then insulin is probably better. This is something that I always tell patients that the medicines are not the only weapons that you have against diabetes. Being in a happy place, surrounding yourself with positive people, having a good environment is already healing and is already a treatment for diabetes. But again, if we can only do so much, if all these interventions really is not working, well, we definitely need to go further and use heavier guns on diabetes. Next. Detoxification. We know that diabetes actually is a disease of higher levels of sugar, fats, and it's a big load for the body to bear. And elimination of these toxins should be a priority. And natural stimulation of the organs, as expressed by this figure here, is needed. Majority of the time, one of these organ system is hypoactive or is not working well. That's why diabetes occurred also in the system. And through supplementation, acupuncture, and IV therapies, we clean these receptors. So the question a while ago about insulin resistance is all about that receptor being cleaned out so that it can respond to insulin properly. And we activate all these excretory drainage organs to eliminate the byproducts, such as, of course, yeah, the excess sugar that we have in our system. And yeah, what organs do we need to emphasize in this drainage? The skin, the gastrointestinal tract, the when you pee, when you poop, when you perspire, all of those you have to maximize if you want to detoxify. Next. So toxins, as you can see here, it's not only about physical toxins. You see the image here. Somebody twisted their ankle, we get a Band-Aid. But that's not the only toxin that I want to emphasize on. You would see here the spiritual, the emotional. These are all toxins that needs to be addressed in order for the organs to function again. And if you lock up and load up on all these toxins, it will lead to organ dysfunction. Next. This is one of the remedies that we use, and this is called homeopathy. Homeopathy is an energy-based medicine or treatment, and the particles of plants, animal extracts, and even metals are used, but in dilute form. This is the smallest amount of that specific remedy mixed in a concoction. And even if I may say, there's probably not even a remnant of that specific particle in there, but it's the energy that's left. That's why it's called energy-based treatments. And this is something that has been used since 1796 to give you just a background of that. And again, this is one of the treatments that has less toxicity just because of the dosing of that specific regimen. And let me give you a good example of a homeopathic remedy that we use in diabetes. Next. Next, there you go. So this is silver, Argentum nitricum. If you believe it or not, it helps with addiction to sweets and controls impulsivity. So being impulsive, that's also one of the problems of diabetics. They just grab whatever they can and feed that sweet tooth that they have. And believe it or not, treating with homeopathy encompasses not only the physical, but also the mental, emotional, and spiritual. And that's a whole another topic that we can discuss the next time around. Next. This is the part where I probably would suggest everybody should take their pen and paper out, or you're going to get a copy of the slides anyway. This is where we actually talk about supplementation. This is where you get it from health food stores, online, over the counter, or even sometimes homemade. The thing here is it's not regulated. People think that, hey, I can take whatever I want. I'm not going to harm myself from this. That's probably a misconception that I want to break. And even supplements, you can overdose, it has harmful effects, and you have to have medical guidance when you use this, especially for the ones who are taking multiple drugs. There might be drug interactions. So, mistakes, most of the time, we follow whatever that neighbor told us that it did so much good for them, and then you of course buy that as well and try it on yourself, or the infomercials that you see on TV that you think that's selling you this supplement that was probably the solver of every problem in the world. So don't be misled by these red flags. Next. So a common supplement for diabetes is cinnamon. So it's the inner bark of the evergreen tree. In the two forms that you would always see out in the market is the quill or powder. Unless you want to bite your teeth in hard quill and lose them all, I would suggest go for the powder. It's one of the oldest spices out there. It has so many multiple uses. It goes all the way back from the Bible in ancient Egypt. That's even more precious than gold. And the suggested use for this is at least a quarter to one full teaspoon per day, or a 500 milligram capsule of cinnamon taken twice a day. And it has actually has been on studies been tried and seen that it lowers down hemoglobin A1C. Next. This is bitter melon. It's a 14th century Chinese medicine, part of their protocol and their regimen. That's where all it came from. It's one of the most bitter of all vegetables. That's why if you're drinking coffee, you just want to wake up, I probably would suggest this one if you just want to wake her up. It just tastes so bad. I've tasted it, but it works for diabetes. It increases the insulin production of your pancreas, maybe because of the bitter taste that it has. And it also has, I guess, the qualities of so many health benefits. It stimulates and detoxifies your liver as well. 20 mil taken on an empty stomach in the morning. So meaning you juice it up and you chug it down like a shot of whiskey. Good luck with that. And I warned you before you should probably do this. Next. Ginseng. So this is actually found in the mountains of China. Well, now we're having questions about products coming from China, but it is where it came from. Multiple uses. It's actually an adaptogen, aphrodisiac, and a stimulant. Increases insulin sensitivity and secretion, and 3 grams per day or per dose would be good enough to help your blood sugar go down. Next. Alpha lipoic acid, it's a potent antioxidant, and it also is fat and water soluble. It improves insulin sensitivity and lowers your oxidative stress. If you're the one who has glove and stocking presentation of numbness and tingling, if you're a diabetic, this one is good for you. You would see that in relation to the dosing, it has different effects. So you want to take 20 to 50 milligrams if you just want the antioxidant effect. But if you're diabetic, you want to take at least 800 milligrams per day in divided doses. Next. So this is the part where you look into your supplement ingredients in the back. You look for chromium. Chromium is actually something good for your insulin to work, may it be insulin that you inject or insulin that you create. Every time sugar goes in, and insulin comes into play, it uses up chromium. So do at least 200 to 1,000 milligrams of this. Next. Vanadium. This is, again, another mineral, and you would find this in the form of vanyl sulfate in your supplements. It improves insulin sensitivity and even lowers cholesterol levels, bad cholesterols. The safer limit would be 1.8 milligrams as you take it. Next. So I mentioned to you about acupuncture, and acupuncture would be focused on activating all these organs and meridians and acupuncture points to stimulate organs again to start to detoxify. And in general, detoxification again helps a lot by removing all these toxic elements of excessive sugar, excessive fat in our system. Next. IV therapy is one of the bread and butter of our practice, and this is where we really excel in helping our metabolic patients, such as diabetes. So we have IVs that can alkalinize you, and I just discussed the importance of being alkaline all the time. Liver detox IVs, we have that to stimulate your liver because that's also where excessive glucose is getting stored. That's why we have fatty liver. And again, people think it's all about fat, but sugar contributes and aggravates a fatty liver as well. Biooxidative therapies, like such as peroxide and ozones, we infuse that to give the body more oxygen distribution. As we all know, diabetes has produced impaired circulation, and these IVs that we give increases the areas that has less oxygen to give it more vibe and also rebuild it again. Heavy metal removal, that's what we call chelation therapy. And this is the one that also aggravates blood sugars to be removed. If it sticks together, glucose and metals, it's just going to be hard to get rid of. That's why we need to separate both through chelation therapy in order for you to release metals and also release sugars out of your system. Next. And these are the results of our interventions. As I mentioned to you, how accurate hemoglobin A1C is, we always want to see, and as we see them in our patients, we lower their hemoglobin A1C levels and fasting blood sugars for with our using our intervention. And again, as I told you, lowering the sugar is the key to actually improve your immune system. It's just a heavy load and it's a hard load to carry for your immune system if you have ongoing diabetes. Next is also getting off medications. People, we always get this group who just, yeah, I don't feel good with my diabetic meds. So what we do is we taper them off and at the same time, taper them with the use of supplementation. So it's a gradual process. We don't tell them, get off your meds now, just do supplements. That's definitely a dangerous move to do, especially for the uncontrolled diabetics. That's why there's a transition period that we do for them and a program also. And of course, we would not forget the foundation of everything, the change of lifestyle, and also the diet, and also the exercising that they need to put in there. Next. So best treatment for diabetes is actually to prevent diabetes. You don't want to have it to begin with. So that's why while you don't have it yet, that's where you want to be. You don't want to be in a place that I have diabetes and want to fix it. I'm not saying that's incurable, but it's a harder battle to have rather with you comparing yourself not having it at all. Next. So this is it's a personal experience of mine. Once I saw Fed Up, you probably can get this from Netflix or any online movie rental that you can click. This is a real story of how diabetes or sugar is actually eating our society. As you can see, this is a pretty old documentary. But if you want more insights and actual good documentation how it's hurting us, this is what you want to see. Next. And as you move forward, you watch out for hidden sugars, and this is what you look for when you look at labels, especially high fructose corn syrup. This is the one that is the culprit of so many illnesses and diseases. And if you have that in your label, stay away from it. Next. So number 11, thou shalt not eat carbs. I think I'm going to have trouble selling that one. So this is Moses presenting the 10 commandments. Now there's number 11. He knows it's a difficult task for him. Even him, he admits that, hey, this is a hard battle to fight. But now you know. Now you're educated. Now you have knowledge. Now you have power. Understanding the disease is always a good way to stay healthy. And next. Well, thank you so much again for that presentation. And it's an honor again to present this to you guys. And I hope you learned a lot.
Thank you, Dr. Nario. We'll be good continuing on with the question and answer portion of this presentation. And feel free to also use the chat if you want, if you have any questions as well. So next question for Dr. Nario is, are there any books you recommend?
Books, yeah, definitely. Books that I want to recommend is How Not to Die. How Not to Die is the best approach that I've seen so far on how to even reverse or control diabetes. This is a book about being on a plant-based diet. I'm not saying vegan. This is different from being vegan. Plant-based diet is more focused on healthy foods such as grains, unprocessed food sources, and just staying away from processed food, meat, would already give you a good prognosis from being away from diabetes itself. And this book is written by a medical doctor. His name is is it's on top of my head, but it's actually the book is How Not to Die. Michael Greger, that's his name, and you can get this as an ebook or an actual book itself.
Thank you. And the next question we have on a Q&A, and I believe you answered this, but is there a best diet for diabetes?
Oh, a best diet, you say?
Correct. Is there a best practice diet for diabetes?
Yeah, as I mentioned a while ago, it's really more about being on plant-based diet, but let me touch on that. I have lots of patients of being on a ketogenic diet, being on a paleo diet. Those are the more common diets that I see. Ketogenic focuses you to eat more fat than actual carbs. The thing here is patients actually focuses on the wrong types of fat. I have seen patients being on a ketogenic diet who eat tons of bacon. And as I explained a while ago, these fatty acids turns into sugar eventually. What a proper ketogenic diet probably should be is consisting more of healthy fats, such as, of course, when we talk about healthy fats, fats in plants, such as mid-chain triglycerides. Those are good sources. Olive oil, that's part of the Mediterranean diet. And now I mentioned Mediterranean diet, that also is one that is good for not only for diabetes, but specifically for cardiovascular issues, such as people who have strokes and histories of heart attacks and also high cholesterols.
Thank you. And just a friendly reminder that after this presentation, we're going to be sending out a poll. So please stick around and fill out that poll for some feedback for us. Thank you. Continuing on, and I'm going to rephrase this question. So is keto good or whole food plant-based better? So I'm going to rephrase it to, what do you think is better, the keto or the whole food plant-based diet?
All right. Yeah, that's a good question. Probably I'm going to be biased about this because I myself, I'm a vegetarian, so meaning plant-based. And that's, again, everybody's different. I don't want to promote a diet to tell you that, oh man, this is good, it's going to work for you. I can't. But the reason that everybody is a different individual. One person can be effective with plant-based, but one person would not be effective with plant-based and would do well with keto. That's why I want my patients to try where they're comfortable with. You can't be on a diet when you're not happy with it. If you're eating vegan or eating just plants and you're just in misery every day of your life, that's definitely not the way to go. You have to find a diet, and you have to perceive the diet to be a lifestyle, not because I want to do this for 1 month or 2 months, and after that, if I reach my objective, I'm done with it. That's not how you should perceive a diet. It has to be a lifelong commitment that you're going to be happy with. And I've seen patients do well with keto. And that's the thing. You just have to do keto right. It's not filling yourself up with bacon and steak every time. And that's what I always see. Trust me. You just have to be more educated in doing the proper way of doing keto. And it can be effective as well.
Thank you, Dr. Nario. Good advice for as we're entering the holiday season. So as I'm going to read this next couple questions here, and this is a pretty robust one. So, hi, Dr. Melvin. I was just diagnosed with diabetes. I'm not heavy at all, 5'8", weight 125, don't smoke, not high blood pressure, exercise and eat fairly well, while my A1C is 9 and my glucose has been anywhere from 290 to 119. They are trying to determine if it's type 1 or 2, assuming it's 1.
Right.
Assuming, excuse
Well,
me,
how old is she?
um, there's no age, but let me complete this. Assuming it's type 1, what can I do in the clinic to make this better? I'm blown away by this diagnosis.
Okay. Well, again, with type 1, I still question that because type 1, you usually see this. Another name for type 1 is called juvenile onset diabetes. Juvenile meaning you're probably in your adolescent stage. You're probably like 12, 13, or even 10. This type of diabetes will appear already. And you're going to be what we call insulin dependent. You're not going to probably live a life without insulin if you're type 1. You're probably type 2. And if you had developed this in the latter stage of your life, it's probably because of, I do understand that you're eating healthy. Again, that's another conversation though. We probably have to sit down and really, what type of healthy are you? And meaning what type of healthy diet are you on? Because I always see these athletes doing like CrossFit. You would find out that they all always want protein. They look healthy, they're all muscular, but when you check their blood sugars and their cholesterol levels, it's off the charts. Meaning, all right, you're looking good on the outside, but in the inside, you're really not. And going back to your point that you're not overweight, you're skinny. That is the biggest, I guess, um, hidden clue that, and also that's also one thing that people kind of puts their guard down on that, hey, I'm thin, I can eat whatever. The thing here is what's happening, your actual sugar is getting stuck in your muscle and even fat that goes along with that. And all of these, though you're not seeing flabby belly fat or saggy arms, it's hiding in your muscle. And that's why your condition is a little bit more dangerous in relation to the ones who are overtly showing obesity, because you're the one who has this mind frame that I'm not actually imposing this on you. I'm just giving you my example on about patients that I see, that they become lax. That's when they say, I don't need a blood test. I'm okay. That's when we find out 4 or 5 years already that has passed that the blood sugar has been uncontrolled and there are organ damage. It's just that when you have this type of presentation, you become more lax than the ones who are physically presenting it. And that's why now this is where also we need to explore your genetics. If your family tree is full of diabetics, and maybe they also have your same presentation, a thin frame, not obese, maybe that's also another reason why you're having this. And that's why this is something that needs a little investigation on. But as I just mentioned to you, these are just experiences, and I'm not pertaining to you specifically. What can we do about it? The same management for diabetics who has adult onset. We also control it in a way of lifestyle, medications or supplementation, detoxification. And again, a better assessment would be done through looking at your blood tests and also doing physical exam on you and getting your actual medical history.
Thank you, Dr. Nario.